So this month's been really busy with a whole host of meetings. I've had appraisers, support group meetings and CCG meetings and also federation meetings. It's also school holidays with the kids and trying to juggle that and the day job of being a GP has been a challenge, but we got there. So I'm a board director at our local GP federation, and yesterday there was a workshop on the accountable care system. This is a very new way of working which really puts the patient at the centre of all the care and breaks down barriers between general practice, community trusts, acute trusts, and there's sort of the theory is that there's one pot of money and there's one patient and we all work together to improve the health of the patient. A colleague mentioned that they were concerned about protecting general practices' autonomy and funding in the new accountable care system where we'll be working with different partners. I remembered learning about the change model and the element called shared purpose, and it occurred to me that if all the organisations such as the hospitals and the community trusts all work together with a shared purpose of improving the patient's journey and making that happen in the most cost efficient fashion, then there would really be no barriers. So I mentioned it at the meeting and we all felt that that was a real move forward, and the next step for us is going to be having conversations with our partners and seeing how we can actually vocalise our shared purpose to improve the health of our patients. I use the change model practically every day in my work and I really wanted to share it with my team. So I brought it along to a whole practice meeting and I actually asked the question, who do you think leads the practice? Because I've found the leadership by all element really helpful in my work. And at the beginning, a couple of people said they thought it was me as the lead GP. And then as we got thinking, some people thought it was the nurse for the nursing areas. And it was by the next 2 minutes, we realised that actually everybody was a leader in their area. And it was lovely to hear even the new receptionist say that. So once we had seen that actually this practice had leadership by all, it was much easier, I felt, for everyone to voice what they thought were the strengths and weaknesses in the practice. It was really nice for me to see the amount of agreement and that everybody in the practice felt our telephone consultations were working really well and were a strength, and they felt that communication in the practice was really good. But one of the areas for improvement that was highlighted by everyone was things like the equipment not working when it's required by a doctor or a nurse. So the spirometer doesn't have batteries in it or the Dopplers not working. And of course the staff member who used to look at that for me is on maternity leave, and I realised that I hadn't trained the new member of staff to do that. This got me thinking about the measurement aspect of the change model, and when I had been on my GP Improvement Leaders programme, I'd found the measurement particularly challenging. And now I can see how important it is. So my next step will be really to use some measurement, and particularly with the equipment, and improve things for us to make it quicker and easier on a daily basis. I'd learnt about process mapping on the GP Improvement Leaders programme, and I was particularly concerned about the nursing time that was being wasted with our travel vaccine service. We were losing 2 hours of our 20 hours of nursing on a weekly basis because families of 4 or 5 would all book travel vaccine appointments and then not turn up. And I wanted to do something about that, and I wanted to use the process mapping because travel vaccines are mainly nurse-led, and I really wanted the involvement of all of the team to see what they felt about how we could make any improvement. So, Shuzna, you were talking about reception and their input into the booking process.
It really helped us after the process mapping, because after we started booking telephone appointments first, and then Shabnam spoke to them on the phone and it was decided what injections they needed. Shabnam did the prescription. It was really helpful for us because we can look at the consultation and see what's happening, and then she would book the patient in to see them. So when patient calls us, we can look at the records and see what's done next. So even if they forget their appointments, we'll be like, the prescription's been done for you, just need to come and collect it. And there's been an appointment booked for you by the nurse, which Shabnam would book it on the first call,
Fantastic.
which is really helpful.
So you didn't feel there was any confusion
No, patients
into
were really
what
happy.
the
Whereas
patient
before
wanted.
we were getting aggression at reception. After this, it was so much better.
There was more structure and everyone understood the protocol, so it made more sense.
And on average, how many complaints verbally were we getting a week?
About 2 a week before.
Right.
Now there's none.
When I used to obviously see the patients on a weekly basis, there used to be on average about 12 DNAs, so 12 slots were unattended. Patients had less value for appointments at that point.
Gosh, the 2 hours were wasted
2 clinical
in your 2-day
hours
week.
wasted, there you go. During that time, I mean, I could have seen patients for wound care or anything, obviously, which is much more priority than travel. So that time was gone to waste. So that was quite a shame. But now, at the moment, the way everything's gone into place and the way it's followed on protocol, we get 1 DNA per week.
Only 10 minutes lost.
Versus to the 12 DNAs. And some of the weeks is 100% compliant. So saves money, saves time, gives more priority to other patients. So it's worked out quite good.
So I was fortunate enough to be invited to visit a local practice in the area, which is a much larger practice than mine, and they've just changed their appointment system because their current system wasn't really meeting the patient's needs or their clinicians' needs, and they've just been using the new system for about 4 weeks. And I had a chat with the practice manager, and she had never heard of the Plan, Do, Study, Act cycle, and while she'd done some planning, she was a bit nervous about how the new appointment system was going to work. So after the practice manager and I discussed the Plan, Do, Study, Act cycle, the practice has now put this in their action plan, and they're going to be studying the number of appointments that are taken on the day and those that are being pre-booked and how they're being pre-booked, whether that's on the telephone or online, and then they're going to act accordingly and see how many appointments they need to release on the day and how many are available beforehand and which method patients prefer rather than coming in to book or online. And it was really lovely for me to be able to share some of my learning with another practice so that it would really impact more patients, not just my own practice. And it was lovely to see the practice manager smiling, and actually felt really good to know that we'd achieved something, because general practice is busy and it's really nice that we can help each other with these tools.